Hello friends, if you haven't yet subscribed to the channel, it will be a good time to subscribe now. Hello friends, here is a clinical case based MCQ. It will be useful at NEET PG preparation and also for first prof students because it has physiology, second prof students because it has got some amount of pharmacology involved. Let's see. A dental surgeon is injecting lignocaine into the patient's cheek. For the first prof students, lignocaine is a local anesthetic agent, also called as lidocaine, and all those drugs that end with caine generally fall into the category of local anesthetics. And what are local anesthetics? Well, they stop the sensations being sent to the cortex. That means the nerve fibers are not sending any impulses to the cortex, and therefore those sensations, and particularly the pain sensation in this case, is not felt at all for some time. That's local anesthesia. So it will create local anesthesia around the teeth or around that cheek area. Which of the following is the mechanism of action of lignocaine? So simply this MCQ is based on mechanism of action of lignocaine. Now basically it's the impulse transmission that is stopped by the lignocaine. Nerve fibers, let's say pain carrying fibers, they are not sending any impulses and therefore pain is not felt. So the only thing that we have to know now is how is it that the lignocaine stops the pain transmission or stops the impulse transmission. You know, the nerves are depolarized by influx of sodium. So here is a nerve fiber shown in a representative diagram. Nerve fiber is shown, and a sodium channel, a voltage gated sodium channel which causes depolarization, has been shown here in the diagram as options. So you see it has got two gates, M gate and H gate, and then L stands for lignocaine. So on which stage actually the lignocaine would act and stop the impulse propagation? Is it when both gates are closed, or is it only when the M gate is closed, or is it when M is open but H gate is closed, or is it when both gates are open? Got any idea what's the answer? Okay, the answer is C, when M gate is open but H gate is closed. This is when lignocaine acts, or it has got maximum affinity to the sodium channel at this stage, and thereby it stops the depolarization and impulse propagation, and therefore the pain will not be felt. Now let's understand it in further details. Look, the sodium channel, the voltage gated sodium channel, which allows sodium influx and depolarization and impulse propagation, it has got two gates. If you see this nerve fiber, there is M gate which is on the outer aspect of the nerve, and H gate which is on the inner aspect of the nerve. M gate is the activation gate and H gate is the inactivation gate. Now, if you see the various stages of the sodium channel and various stages of excitation of the nerve by influx of sodium, when the nerve is resting at RMP, resting membrane potential, sodium channels are in a resting state. And resting state means the H gate, which is the inactivation gate, it is open, but the M gate is closed. So M gate is closed, and therefore sodium influx is out of question. Sodium influx will not happen at this stage. Fine. Then as the stimulus is applied, sodium channels will be activated. They will open. Means the M gate will open. H gate was already open. Now the M gate is also open. That means the channel is completely open. So sodium influx will happen. Sodium influx means a depolarization, and depolarization at one point, action potential generated, and then it will be propagated through the nerve. That is how the sensations will be felt. But then just above threshold, when there is a spike happening and the action potential is being or depolarization is being completed, the sodium channels go into third state. Just above threshold, as the massive influx of sodium has already occurred, sodium channels go into the third stage, which is called as inactivation state. This is also a closed state, but it's called inactivation state because H gates are closed. Inactivation gates are closed. And that means the channel is closed now, inactivated, sodium influx cannot happen, sodium influx will stop. Now, sodium channels are not excitable at all. Only when they return to their original resting state, slowly they will, during repolarization, at some stage, the sodium channels will return to their original resting state with the M gate closed and H gate open. But unless the sodium channel goes back to into this stage, it cannot be activated again. It can, and then therefore the nerve cannot excite for one more time. It's called as refractory period. So now lignocaine has got a high affinity for or preferential binding, as they call it. It prefers to bind at this state of the channel, inactivation state of the channel. So lignocaine will come near the channel, it will enter the channel, and it will block the pore of this channel. At what stage? At inactivation state. Now lignocaine binds preferably in this state. It binds to the inactivation state and it prolongs that inactivation state. Because the lignocaine is coming and binding on the inner pore of the channel, now the channel is unable to go back to its original resting state. That means the channel cannot be opened again, and the nerve cannot be excited again. So lignocaine, in summary, it binds to the inactivation state preferably, and it prolongs this inactivation state of the sodium channel, where M gate open but H gate is closed. And in this state, of course, impulse generation is not possible, depolarization is not possible. Sodium channel has to go back to its original resting state, which is not happening as long as lignocaine is active or lignocaine is present and acting on the channel. And that's the answer to this question. So what you should remember is lignocaine preferably binds to inactivation state of the sodium channel, which comes after the activation state, by the way. So if the nerve is resting and if you give lignocaine, it may not be that effective. But if you send some impulses to the nerve first, activate the nerve first, and from activation state the sodium channels go into inactivation state, lignocaine will be more effective. So that was the answer to this particular MCQ.